The WHO's declaration will help rally efforts, but what is being done right now to stop Zika spread? Dr. Stephen Higgs is joining us now. He is director of the Biosecurity Research Institute at Kansas State University and an expert on infectious diseases. Stephen, before we get to that, let me ask you your thoughts about the WHO's action. What does it mean for people like yourself?
Well, I mean, this just shows the seriousness of the situation. So I think their proactivity at declaring this is going to help things move forward. It will bring countries together and get the research and the data that we really need to understand the situation.
How about advice to public health officials? Brazil's launching a door-to-door campaign. Do you think that's going to be effective? What steps can be taken now?
Well, that sort of measure is appropriate. These mosquitoes that are transmitting this virus do live very close to homes and often inside the homes. So that door-to-door type of activity will inform people and kill the mosquitoes where they're most of a threat.
Do you also share their concerns about Carnival, the Olympics, that this could be like ground zero for a quick spread of this disease?
Yes, well, this virus depends on the abundance of naive people who haven't been infected before and the presence of mosquitoes. The more people that come into the area, the more fuel there is to sustain that transmission.
And what about education? We know standing water is a huge problem in the spread of this, in tires, people storing water. We've seen this in some parts of Latin America in the past. What about education, getting people out there to educate people to avoid that?
That's absolutely critical. Getting the community to understand how they can help by what they say source reduction, removing those breeding areas for the mosquito, depresses that population. And having a well-informed population makes taking the measures and spraying for the mosquitoes acceptable to them.
Stephen, you and I have talked in the past about vaccines. You said don't expect them in the near future, and we're hearing that from a lot of folks. Does the WHO's action accelerate it some, and why does it take so long?
Well, I think the infusion of funds will, and the declarations by the WHO will certainly move vaccine development forward, so increase the pace of vaccine development. But you cannot shortcut the approval process, and that's why it does take a long time. To use these vaccines, the people have to be confident that they are safe and effective, and that takes time to accomplish.
Has this been overblown at all? Lots of folks not at a high risk. And what about pregnant women? Are there guidelines to avoid pregnancy in certain countries? Is that just adding to the fear? What do you think about that?
It's a responsible thing to do to tell people who are at greatest risk, and clearly pregnant women seem to have a specific risk in terms of passing on this virus to children. As you said, as a previous presenter mentioned, this has not been absolutely proven yet, but the WHO say that the circumstantial evidence seems to be very strong. So is it an overreaction? No, I don't think so. It's a responsibility to keep the population at risk informed.
What suggestions would you give to pregnant women if they're in these vulnerable countries to protect themselves?
Well, the best way is to try and avoid mosquitoes, which isn't always easy. One method is certainly to use mosquito repellent, which is freely available. Follow the manufacturer's recommendations. It's difficult to avoid these mosquitoes because these ones feed during the day, but during the day, try to wear long pants, long sleeves, that type of thing.
Stephen, as you look out at the future within the next 6 months to a year, what do you expect to see?
More cases in more places, unfortunately. We're clearly going to see a ramping up of research and education efforts related to this virus, which will move us forward to developing a vaccine and killing the mosquito populations, reducing those populations. But it's certainly not over yet, unfortunately.
There was the prediction earlier that this is going to affect the Americas, with the exception of perhaps Chile and the United States. Can it spread further?
Yes, I think so. This is a virus in a new region, and we don't have enough information on how it might interact with other mosquito species and the wild animals out there, for example. So we will see more cases.
And we have a lot of viewers in Asia. Any chance it can end up there?
Well, it is a virus that has occurred in Asia, and we're seeing travel-associated cases from the Americas taking this virus to other countries. International travel is fast and easy these days, and if somebody gets to a country where there are abundant mosquitoes and they get virus in the blood when they arrive and are bitten by mosquitoes, then that is what is causing the problem.
Dr. Stephen Higgs joining us from Manhattan, Kansas. Thanks so much.
Thank you very much, Michael.